Hello and welcome to the Pre-Chiro Podcast. I'm your host, Dr. Ben Glass, and today we're making a professional chiropractor connection out in Florida with Dr. Eric Goodman. Eric, can you get us started by just introducing yourself and reflecting on where you were at in life and what attracted you to become a chiropractor?
Yes. Yeah, absolutely. Well, I'm currently in my daughter's homeschool room, which means I'm doing something either very right or very wrong. But it's feeling good, so I think it's pretty right. It's 2023. Approximately 12 years ago, I put a book out called Foundation that was based on my experience very personally with back pain and kind of being faced with the idea of, do I get a surgical intervention or do I go the route that makes the most sense to me, which is strengthening and aligning and more of an active chiropractic principle. I think I was in chiropractic school at the time when it was all going on, and it really defined my life in a lot of ways. That should I go the passive route or the active route? That decision-making time, it wasn't a moment, it was years. But from about 26 years old to about 30 years old, I very actively rehabilitated my spine and kind of figured out some ideas that seemed to really work well for me. And then I integrated them with my education as a chiropractor. So I've never gone the conventional route. I never had a clinic. I've never been in that situation, but I've always worked very clinically. And I've always had a very interesting network that's grown over the years of different clinicians and athletes and teachers. A lot of teachers, a lot of scientists that, for whatever reason, have been attracted to the idea that with movement and breathing, we can really do a lot with the body. Just like in chiropractic, with aligning the spine, the body responds with efficiencies. We have found that by aligning movement with strength and isometrics, and then putting a very distinct, expansive breathing protocol within that frame, you can actively align the body beautifully. And that has defined my life significantly. I'm 42 years old now, and my life is foundation training in a lot of ways. I have a family, and we all talk about, like, it's just, you kind of live it, all of us, everybody in my circle, everybody from our team that's family members, brothers, and very dear friends that went to chiropractic school with me. You know, posture and understanding biomechanics and to a degree, and helping people to understand it to the best they can has really defined my whole life. And here I am in Melbourne Beach, Florida, with, foundation training is on a nice upward trend for many years. We're on a slow, steady growth trajectory, and people are respecting the work and understanding why we're doing it and that there's some legitimacy to it. So I'm very happy with all that. And the chiropractic profession has been very supportive of what I've done over the years.
Absolutely. Of course we are. You're very much an embodiment of being a chiropractor and applying the principles of chiropractic to problems in society, shall we say, patterns that you can observe in people, and finding solutions, natural, sustainable solutions and strategies. So I'm wondering if you could answer this question of, like, what my original question was really about, like, where were you at in life? What was your upbringing like? What was your background before chiropractic school that really primed you to be in a position where you said, okay, going to become a chiropractor is a logical decision, or maybe it wasn't that at all? I'm just curious where you were at in life when you decided you were going to go to chiropractic school, and what attracted you in that direction.
Great question. So when I was 16 years old or so, I started becoming really interested in what my uncle, my dad's brother, was doing. He was a chiropractor, but it wasn't because he was a chiropractor that I was interested. He was just doing cool stuff and always seemed to be learning things. And he would always, every time he would visit, he'd have a new toy, a new tool, something that he was excited about. I remember the first time I saw an activator, he brought it to the house, and I was a teenager. So that was my initial, oh, this is interesting. This is cool. This is healthy. And he was a very healthy guy, still is. Then when I was in college, I went to University of Central Florida. I studied kind of general health sciences. When I got that degree, while I was going through school, I worked for a doctor named Dr. Jeff Boz, a chiropractor, Tuscaloosa Chiropractic Center. And I helped him rehabilitate patients. And I had a personal trainer certification, but really had my eye on understanding the body a lot. And he was pretty open-minded and probably a little too open-minded to bring me in and have me working with patients, not hands-on like a chiropractor, but through exercise rehab and things. Probably a little early, but it gave me a lot of like good lessons. And that was great. I got to work through school in a chiropractic office. And then when I was applying to schools, I was like osteopathic or chiropractic, which one? Which one? I never did I want to really go the allopathic route. That just didn't make sense to me. I didn't embody that. It wasn't the right feel. But osteopathic is rooted in osteopathic manipulative medicine, and chiropractic is rooted in what I would consider to be a more rooted overall philosophy of aligning the body accurately. And I don't know, it just made sense. I can't make it any more eloquent than that. I looked at the routes. I shadowed osteopaths. I shadowed chiropractors, and I worked in a chiropractic clinic, and I saw the patients, and I talked to the patients, and I helped the patients. Yeah, it was just a no-brainer. Once I was in the clinic and seeing the hands-on approach being expressed over and over again, and more important than that, listening to patients report that their lives were being improved as a direct result of the doc doing the work. I got to see that for a good few years. So then I enrolled at Logan. I graduated UCF, Central Florida College, got my bachelor's, enrolled at Logan in just outside of St. Louis, Missouri, and then started my journey in 2004.
Amazing. So knowing that chiropractic school can be a completely different experience depending on your background, I'm just curious, like what your experience was like going through chiropractic school, having a family member who was a chiropractor, having that previous clinical experience. Like, what were some of the ways that you were able to maybe have deeper experiences or go deeper with certain material because of your pre-chiropractic experience, shall we say? And I would love for you to kind of finish this response by just, with what you know now, maybe provide some advice for somebody who's clear that they want to go to chiropractic school. How would you maybe give them some awareness building that they can bring with them into the program of their choice?
Okay. Once more, first question.
First question was, what was your chiropractic student experience going into school? And second question is, what would you recommend with the experience you have now that students take?
Okay, perfect. So going in, I wanted to be a sports doc. You know, I looked at sports medicine as a perfect use of the chiropractic idea. This isn't before, but once I was in school, I was really on track for sports medicine. Before, I was an athlete. I played water polo. I played ice hockey. I worked out in the gym. I was a personal trainer. I literally got certified at my first year of college. I was a certified personal trainer. It made sense. So immediately I had to learn anatomy in high school a little bit. Then I learned anatomy for the personal trainer certification, which was very musculoskeletal based. You might hear a little crying in the background. My daughter's having a little pre-dance issue. That being said, it was very trainer focused, very athlete focused. So when I got to Logan, I was pretty solid on anatomy. I remember taking the course and being like, I could be like a TA in this course if I wanted to. Then we got to like neurology and neuroanatomy, and I was like, oh no. Okay, that took a lot. You know, there's levels as we all learn, and when you're pursuing a doctorate, there's levels. There's levels to everything. And chiropractic happens to be probably, other than a specialization in neurology, the highest level of neuroanatomy that I think you get in any of the medical schools, which is it's amazing. The knowledge you can carry over, the conversations you can have, the things you can understand in patients. It's incredible. So, sorry, back that up to my experience. Very based in musculoskeletal patterning and strengthening when I was young, and I took that into chiropractic school. Now, what I do now is all patterning work, but it's very different than what I understood going into school. In fact, I had to unlearn a lot of what I learned, something I help a lot of people do with our work now these days. I had to kind of look at things from an integrated web instead of a piecemealing of how everything worked individually. If I could go back, the first book that I would read in high school, if I was truly interested in like human physiology and anatomy, Thomas Myers' Anatomy Trains. Understand the integrated web of the body. Get your hands on fascial books. Get your hands on Somatics by Hannah. Thomas Hanna? Yeah. Look at what Feldenkrais was doing. If you're interested in movement, look at what Egoscue does. Look at what I do. Look at what... We're okay. We're okay. Time out for 1 second. Let me double check. We're okay. We okay? Yeah, we're okay. 5-year-old. So if I knew what I knew now going through school, I would want to understand the interconnectivity of the musculoskeletal system and how it integrates its kind of fascial imprint on the entire web of the body, which ultimately radically influences spinal alignment and vice versa. So I'd want to understand that relationship because I think it would give every person a heads up on treating symptoms down the line. But you can't just get that. It's like learning to surf. Yeah, you can learn to surf and get on a wave. But if you really want to learn to surf, you got to do it all the time. And in 10 years, 20 years, you're a surfer. You get it. It's part of you for any kind of sport like that. That's how anatomy works. That's how fascial webbing works. That's how breathing patterns work. That's how postural patterns work. Ultimately, if you spend your time learning that, when you're entering and exiting chiropractic school, it will be part of your education. And you'll have utilized all of the previous education, learned chiropractic's integration and individual styles, and their rationale for diagnoses and their rationale for treatments and their rationale for all these different things inside of your understanding of the body. That's what I would do differently. If I and I hope one day, I think some people are starting to. I think that the internet has provided incredible education opportunities for people. So you could know a lot of what you need to know for chiropractic school well before it, and then really get not just feedback, but more experience, more ability to integrate with conversation than just be learning information. That, as we all know as practitioners, it's the conversations with patients, it's the experiences, it's messing up a few times until you get it right. That's how you learn. That's how we become good. So anyways,
there's so many directions I could go with that. But if I was just to reflect on present moment, I recently started teaching adjusting at Life West. And in the classroom yesterday, I was teaching them about how important it is to get comfortable in your own body moving around the table as if there was somebody that you were adjusting, even if there's nobody on the table. And I was mentioning foundation training. I'm just wondering if you could maybe apply some of the fundamental principles of foundation training, maybe introduce it to prospective students and current students, and then connect it to the practice of chiropractic, the art of chiropractic, and then also to the science of chiropractic and understanding how the spine connects to the rest of the body.
Sure. Well, first and foremost, the spine and the body, same thing. It's all one. We're different. We got 3 germ layers, and that's what we're made of. And before that, we got like some subatomic stuff or whatever it is. I don't know how it works before the germ layers. That's too small. Foundation training is an expansive exercise protocol. Right now, I'm leaning in on a chair because you're not always supposed to be in ideal postures, supporting yourself with these kind of resurrective postural muscles that we teach. In chiropractic care, as a chiropractor, or as a chiropractic patient, the goal is efficiency of vitals and musculoskeletal contractions. That's life. Your vital system feeds your brain and utilizes your brain. Your musculoskeletal system utilizes your brain and kind of describes what's happening to it. So if we're aligning a pathway passively, we really leave it up to the pathway to figure itself out. Which in an ideal world, I believe it does. But the world is very far from ideal these days in so many chaotic ways that chaos outside of us, it makes it harder and harder and harder to focus on what we're feeling when all of our sensation is kind of handed to us, especially through technology, through just non-natural forces. So with foundation training, we teach you to basically expand your axial skeleton, the part of you that surrounds your spine and utilizes your spinal column. The axial skeleton expansion of the thoracic cage, the clavicles, lifting the skull, that allows the appendicular skeleton, fully connected, fully integrated to the rest of the body, but different in its pulls, the shoulders, the hips, the pelvis. That expansion of the axis of the rib cage and the spinal column allows all of those extremities to hold alignment better because they have a bigger dispersion of force and a broader attachment point into the axial skeleton. The pelvis being aligned accurately, which is neutral, not pitched back, not pitched forward. In fact, the pelvis should have everything kind of pulled away from it, not towards it, to find center. And that's, again, these are the principles. These are the anchoring principles of foundation training. Anchoring the pelvis, facilitating decompression of the torso. You need something to pull off of if you want to remain in alignment. And your skeletal structure is perfectly oriented to have these pulls in place if your body is aligned. And if your body is aligned, these skeletal structures kind of they perpetuate it. It's a perpetuating strengthening system, which is why isometric exercises work so well. The system feeds itself. It wants it. The more you do, the better you feel, the stronger it gets. Foundation training is an active alignment to complement the passive alignment that the patient receives in chiropractic. And that strength and that autonomous capacity of the patient to pull themselves back into a healthier position will absolutely improve outcomes with passive alignments that the chiropractor performs. As a chiropractor, we are torquing and twisting and manipulating people. And some of those people are big and some of those people are really small. And we have to get our body into not only positions, but positions that can apply fast, accurate pressures. I pride myself on my capacity to apply very accurate pressure if I were to adjust, because I know how my body can hold itself. And I've managed to coordinate myself in the woodpecker position, which is a lunge position that you can allow your pelvis to be the dominant mover in for a side posture adjustment as a chiropractor. Or a wide leg founder at the end of a cervical adjustment, where your hips are drawn away from the patient, pulling your torso to them naturally, making your body a bowstring that is ready. It's like loaded, and all of that tension drives through that closed kinetic chain, which is no longer closed because of this, it's closed on the patient. And you have accurate forces from your hips guiding your spine, guiding your shoulders and fingers. And it's those open nerve pathways of the brachial plexus that are supported that facilitate the healthiest adjustment you can provide and the healthiest structure your body can kind of hold itself in, giving you more strength as a doctor. And we have so many examples of chiropractors and other forms of doctors that use our postures as a big part, like daily yoga while they're with patients. You know, I don't care who calls our stuff yoga anymore. I used to get offended. Now just do foundation training and I'm happy. Call it whatever you want. Call it broga. A lot of people call it broga.
I'm wondering if you can maybe tease out some of the details of how it can integrate into somebody's daily life and apply that to a chiropractic student's daily schedule. They're sitting a lot of the times. Maybe just speaking on how chiropractic school can really push students towards a sedentary lifestyle, and how foundation training can be a nice framework to keep students offsetting those stresses and maybe even proactively learning and applying the anatomy in class through movement just because of foundation training's roots and also application within the context of human physiology, human anatomy, and obviously you're a chiropractor.
So the application of foundation training principles to any range of motion is the idea. And again, it's not the idea of live in this posture. It's when you're going to challenge your body, or when you think you're going to do something very passively, like brushing your teeth. That's the ideal moment to put in place these principles and create like an actual functional training moment for yourself. So brushing your teeth is my ideal example, and I'll give others, but this is the easiest one. We often push our hips against the sink and kind of curl forward. And all I teach people to do is angle their feet inward, as we do in a lot of our work, to open the hip joint posteriorly, and then allow the sacrum to travel away back. You know, let the hip hinge back away from the sink and just support yourself on the posterior chain while you brush your teeth. And it becomes an immediate habit that people use for pain relief. A lot of our patients and clientele, they can't afford to go to the chiropractor all the time. They can't afford to go to the personal trainer. They need our videos. They need really basic instruction, and they will do it. So if I can use something like getting up off of the couch to practice counterbalancing accurately, or getting up and down off of the floor to practice, accurate hip ranges of motion that support the spine, or if I can practice getting something out of the higher drawer of the refrigerator or shelf of the refrigerator and using a lunge to get there to really support and strengthen in that moment, that's how we use it. Now, chiropractic school sucks because it's school, but it's wonderful because you're learning, but it sucks because you're in a chair for 8-10 hours a day. I remember it. I'm glad I went to chiropractic school, and I'm very thankful for my education. I'm proudly a doctor of chiropractic. But boy, if they could just have you standing, what a difference that would make. What an incredible difference that would make in the capacity to get education. And I think people would get a lot less tired than they think they would get standing all day. And they'd have a much better focus than they think they would have. Look at corporate America, which has gone to standing desks pretty much across the board in any relatively progressive company. Anyways, I digress. In chiropractic school, learn the counterbalance up and down, up off of your chair, and prime yourself. Use those little moments to strengthen the posterior chain, to connect the adductor line, to understand, most important lesson of this whole interview, understand that your adductor muscles form a centering, spiraling like a scroll moving towards center, closing rotation into the pubic symphysis. And that center of gravity pull is huge in so many symptoms across the board, and symptoms you would not anticipate it being very impactful in. But it's the center of you, and it has a bilateral pull from the center of the pubic symphysis. Understand that pull. Understand how your pelvis is stabilized from pulleys below it, as your spine has the availability then to be lifted above it through breathing, through posture, through appendicular support, and axial expansion. If you can understand that relationship, you're going to help a ton of people and yourself. Because it's not just about being passive anymore. You have to, even in school, learn how to make your body work better for you. And the more you can do that, the better you're going to treat every patient you have, because you'll have felt and helped more of what they go through. If you're in school and you're like, oh my God, I don't know what to do, figure it out. Start looking at YouTube videos across the board, figure it out, because patients are going to come to you for this. You can't adjust, and that's really all anymore, even though I wish you could. And I love the philosophy, of chiropractic, but I also love a lot of idealistic approaches to life. And in idealism, there is some reality and some ideal. And every chiropractor eventually gets faced with, well, yeah, you need more than the adjustment for that to stay in, or this or that. And I want those chiropractors to love the adjustment with all their heart, and also respect the other things that patients need, like autonomous strength, the ability to pull themselves together when you're not there to fix them. That's a body that responds well. So chiropractic students need to learn a lot more than just chiropractic when they're in school. And the more they can, the better of a doc they'll ultimately be on the outside.
Yeah, I think that's a perfect segue for you to maybe just speak about why the foundation training level 1 certification is a really great resource and a really great pathway for students to take, even early on in the program, or even before the program, maybe even at the end of the program, and maybe speak to how it could be supportive to students at different stages of their educational experience. And then maybe also talk about how the platform is used by chiropractors such as myself to provide a resource to patients who have specific challenges that they're dealing with and trying to move through, and just need a really clear, simple, specific strategy like foundation training to do so.
Okay. Thank you for the opportunity to do that. That wasn't my plan, but I will happily talk about what we do and how it can benefit students and chiropractors alike. So I've been teaching certification courses since December of 2012. And with the exception of the pandemic, we've taught several per year. And in fact, it was because during the pandemic, we couldn't teach in person. We created the app so that we could do what we needed to do, that we could educate, we could continue our business going. And luckily the app did well enough to help us and get us through that time. The app is an incredible resource. It's a streaming site that just teaches foundation training across the board. We have about 6 different instructors. I'm the lead instructor with another guy named Coach Jess Solis, who's a very talented instructor. And we teach you our philosophy of how the body holds itself and how it can be trained. We teach you protocoled exercises, and each one of those exercises is based on anchoring and decompression. And that's how we help patients get out of symptoms. That's our method. What you learn on our app is our pain relief technology, as I'll call it. For budding doctors or current doctors, so we've got, I can't remember the exact number, somewhere between 1,200 and 1,400 instructors around the world. We've done pretty well, but we've had a nice steady growth. We certify approximately 100 instructors a year. And in doing that, we're not selective, but we have such a niche and such a specific education that unless you're really into it and really see the value of it, you're not going to come do it. It's not cheap. It's very time intensive, and it's legitimate. It's significant. What you're learning, though, is what I talked about I wish I had going into school. You're learning how the body connects. You're learning how the axial skeleton and the appendicular skeletons work together, not one muscle at a time, but as a extraordinarily integrated tissue system. You learn how breathing is not just a chemical situation, like in through the nose for this reason and that reason, but has this scaffolding-like capacity in the body where you can use the rib cage and its positioning to lift the tissue away from center and kind of pull towards that lift. And initially it's very hard and kind of shaky, but eventually in all these different poses, that lift becomes a really cool, empowering tool that kind of gets you out of pain really steadily. I still can't believe it, but it works very often for a lot of people that have chronic pain. This can be something that they can turn to on a very regular basis with a lot of dependency and trust once they learn it. And in the certification, that's a tool that you can use as a doctor, as a patient, and as a provider. You can coach family and friends with it. You can use it for yourself and you can use it for your patients. And it will ultimately naturally become the postures in which you adjust patients. If you do foundation training long enough, it will naturally, without thinking of it, become the postures in which you adjust patients. And I challenge any doctor that's taken my course to tell me otherwise. Eventually, if you do it, it happens.
I would love to just share that when I went through the certification maybe 6-7 years ago, I was thinking there was a third principle, which was integration. And for me, that was the neuroplasticity, the neuroplastic changes that took place over time of practicing foundation training and repatterning and retraining your body to move better. And so I really felt like integration is a true third principle beyond anchoring and decompression. And I liked it. I'm curious where you're at with it these days. And
it's all there.
It's still there. Okay.
Well, yeah, it's there. It's just hard to explain.
I hear you.
Because the others I can explain structurally very easily. Whereas integration, as you described quite well, integration is 2 things. One is the neurological acceptance and adaptation of foundation training into your structure, into your function, which is exactly what you talked about. The other is the legitimate integration of the anchoring of the pelvis against the decompression of the torso, working against each other. It's an integration of tug of war. So that there's sort of 2 expressions of that principle. And that's why when I'm teaching this in a kind of a general way, I give it very anchoring and decompression. Those are the principles that make up our poses. The outcome of them yields integration.
Absolutely. I'm just curious, looking at just kind of the world around you today, we're probably more sedentary than we've ever been. We're more technologically oriented than we've ever been. One of the things that has really come to the forefront of my mind, and I would just love your feedback on it, maybe we could just dialogue on it for a moment, is looking up and the importance of looking up, whether it's talking about cell phones or tablets or TVs or computers. I'm just curious what you've played around with as far as looking up, because I know that just looking at psychology journals, looking down, and that whole internal rotation of the shoulders and collapsing forward, dropping the sternum, right? Like one of your mantras is chest up, chin back. And so like we're doing the opposite of that. How can we create technology accessories maybe to impact, like not empower, but just to move people in the direction of looking up more? I'm just curious what your thoughts are on that.
I don't know whose quote it is, but it's never made more sense. You can't ask the thing that victimized you to heal you. So let's not look at ways we can yield our cure of technology through technology. Let's instead do exactly what you just said. And let's just look up more. Let's expand our chest more. So let's listen to Dr. Andrew Huberman gave a very eloquent and radical discussion of how lifting the eyelids and looking, not like just gazing up as high as you can, aggressively looking up, has all kinds of really interesting chemical and hormonal changes and acts almost like a refocuser, like caffeine for the body. So he's much smarter and understands the neurology of that a lot better. Here's how I base everything that I make decisions on when it comes to foundation training. Does it feel good? Yes. Okay, wait. Does it feel good again? Yes. Okay. Let's do it about 1,000 more times. And then maybe we start to consider adding it to the repertoire. When it comes to looking up, that's not like a foundation training thing. That's a human thing. The human being is not a scavenger. You know what I mean? Like we're not like looking on the ground, scavenging. Pretty interesting cerebral being. And I think there's a reason that everything kind of aims up. You know, there's a reason that things reach toward the sun. The reason that we can see things very attractively as the sun comes up, and the higher it is, almost the better we can see. Yeah, look up. I don't know why, but yeah, it feels good to look up, and I feel like we really should. And things like that, instead of making a new contraption that you can tie to the back of your head so that you're just like holding your cell phone right here or something like that, just look up. And you want to know what the coolest thing about the sternocleidomastoid is? It's the surprise muscle. Let the really cool stuff and the chaotic stuff and all of that, all the crappy stuff too, let it surprise you a little bit. So you kind of pull your head back just slightly and boom, there they are. They just activate. And that front neck muscle should be holding the weight of your head, not the back neck muscles. When the front neck muscles are pushing you up from the back of the skull, exactly what you're talking about is not gone. When we let our head drop forward, we slack the front neck muscles. When we lift the back of the skull, we engage the deep neck flexors and the front neck muscles. And when those are engaged, our posture is substantially better. Our breathing is better. Our brain function is better. The pathway is more efficient. We're aligned, or at least closer to it. That's what we're kind of made for. Whether we're supposed to look up or down, we're supposed to look all directions a little bit, you know? And what happens is we just get fixed. We get fixated right here. We do it. I do it all the time. Everybody does it. Technology is really fun to look at.
Well, so in a lot of the foundation training moves, we're talking about retracting the chin almost to engage the back of the neck and lengthen the suboccipital muscles, lengthen the posterior neck. And there was a neurosurgeon in the 70s, not Bragg, I'm forgetting his last name, but basically did dissections of cadavers and identified that if it's of a spinal cord, or if a spine was in more of an extension, that it would open the spinal cord, the anterior spinal arteries in the spinal cord that powers all the arms and legs and the visceral organs. And if it was in flexion, that it would be reducing the size and of those arteries. So I'm just curious, like how the second part of this question is like, I remember in the certification you talked about, you know, we don't have proof of this in foundation training yet, but it's pretty clear that if we expand the rib cage and we flatten and increase the surface area of the diaphragm, that we're taking in more oxygen, or that we're changing the sort of oxygen absorption. And I'm just curious, like, if there's any anything that I just shared right there, those two pieces that is being actively explored that you know of through the context of foundation training, like measuring what decompression breathing means on a chemical or a mental level or anything like that. I'm just turning it back over to you just to share kind of anything that's going on or that you would like to see maybe if we had an influx of a couple $1 million to do some really cool research that would position this in the forefront of sort of the analytical people's minds that this is really important because they have data now.
We're involved in a couple things. So we did a preliminary study with Los Angeles County Fire Department, largest fire department in the country. And it was good. It was a beta test, but the results were phenomenal. And it will lead to more testing outside of the department, hopefully with some schools. We want to get into the university level next. The testing results showed that decompression breathing, so we didn't get to a chemical level. We found, and I can get these results there. We used to have them on a website, but I think the website is no longer there. If it is, it's foundationtraining.work. If it's not, I can send you a link to it for afterwards. I can't remember exactly what it is. Anyways, we did the study with LA County, 8 weeks of 10-minute a day decompression breathing and decompression exercises coached by certified instructors. The recruitment class that was going through it had a 1/10 injury report of the normal recruitment classes, significantly lower mental stress discrepancies and issues, significantly improved grip strength, significantly improved lung volume, significantly decreased injury. I think I said injury reports. Yeah, it did. But like, I mean, a 90% reduction of injury reports compared to normal LA County recruit classes. Now, a captain at LA County, Evan Halquist, is on our core education team and foundation training. He's been one of our instructors for many years. Evan was able to get this really through the department in a pretty interesting way. And it got to be as legitimate as it could get. We actually used the FMS screening. I don't know if you guys know that, but FMS is like the gold standard health and movement screen physically. And these firefighters started at a 14, which is very suboptimal and basically shows that they will very likely be injured. And each of them had a 40% I'm sorry, not each of them. The average improvement was a 40% score improvement over the course of, what was it, 19 was the score they went up to? It was a 4-point or 5-point. I think it wasn't 40%. It was 4-point or 5-point total average score improvement over 8 weeks, 10 minutes a day of foundation training by third-party testing of the FMS scoring system before and after. So that was a huge result. And we had the McKenzie bracing scores and things went through the roof. Like the results on standardized tests of physical movement by these recruits was phenomenal. And LA County still does it. It's a big part of their culture there. It's a really nice thing to see. But we never took the testing further because that's when funding and different money comes in. It becomes an expensive process. Our next step, I'm close to Orlando now, and I went to University of Central Florida, so we're going to speak with their medical school and physiology lab. I just spoke at the American Academy of Osteopathy's annual conference, which was wonderful. We had 1,500 osteopaths get to learn about foundation training. Some of them already knew about it and were into it. But yeah, that was a big moment for foundation training. So we're going to also be working pretty heavily on getting research in the osteopathic community, just like I want to get research in the chiropractic community. So I want to see it from many different angles. How does foundation training facilitate the allied health professions? That's one of my goals of research. And from there, I'd like to see how does foundation training improve both the biomechanics knowledge of doctors across the spectrum and the rehabilitation knowledge of sports medicine practitioners rehabilitating physical bodies. That's where I want to be with this.
Thank you for that. I appreciate it. And is there anything that you would kind of just from your vantage point shine a light on the culture within the professions, right? Chiropractic is a rather fragmented profession. There's a lot of amazing groups and pockets and tribes and subcultures within chiropractic, but it's all operating sort of independently. And now for you to step into an osteopathic conference and just witness the culture, what were some of the contrasts that you could maybe draw upon just on your experiences and then your observations that you made?
None. Just doctors that want to help people. That's it. They all have slightly different perspectives on how they do it, but their goals, their language, their capacities are so similar. And that's the beauty of it. The fragmentation is all very often perceived just like politics. Like we all want to feel right in our perspective, But ultimately, when it comes down to it, we're all practitioners that want to help people, and we want to have a good life, and we want to enjoy what we're doing. And if there's something cool to learn, we want to learn it. That's it. That's what I see. That's what I've experienced. Nobody at that conference cared that I was a chiropractor. They didn't see any difference, and I love that. And I know that it would be that way if when I know that because I had osteopaths come to my chiropractic schools. I went to 2 different chiropractic schools, and we had osteopathic instructors. It's such especially DOs and DCs. There's a really shared knowledge base there, and the MDs that I've interacted with, I've always had very good relationships with and good outcomes with. I've spoken at large medical doctor conferences of allopathic medicine as well, and felt the exact same type of reception. I think very often what we perceive is not always the case. And sometimes we think fragmentation, it's not fragmentation, it's tribalism in a healthy way. We need healthy groups. We're not supposed to be connected to everybody. We're supposed to be connected to a tight group. And in nature, perhaps those groups are warring sometimes if resources get limited, but we're in healthcare and people are fucked. We have plenty of resources of people that need help. We should only be helping each other. That's it. And if we don't understand what the other group does, don't get mad at it. Don't bash it. Just say, I don't understand what they do, but I know what I do, and here's how my stuff works. I don't get the divide in health, man. We're all fighting the same thing. We're all on the same team.
Awesome. Let's just bring this really quickly back to the practitioner, the chiropractor. What are some observations you've made of the different foundation training instructors that you've certified who were clinical practitioners, and just observations you made of how they've integrated it into their care model for patients that they're taking care of?
Yeah, most that come through the course do one of 2 things. First, I would say all of them integrate the movement patterns as practitioners into their own practice, into their life. But then from a patient standpoint, usually once they get good at teaching it, they'll teach 1 or 2 pieces of foundation training, be it the decompression breath, or maybe they have to zip the legs up or internally rotate, teach a basic hip hinge in our style before they get adjusted to warm up the body a bit. Then they'll take them through the adjustment process, the soft tissue process if they're doing that, whatever it might be. And then they'll get back into kind of that same position. Again, anchor everything together, hold the position, fire the muscles for a minute or 2, out you go. The other way they use it, because you have to be that quick as a doctor. You can't be long-term with patients in foundation. You can't teach them a 30-minute class. I get that. But you can give them an exercise or 2 pretty easily. Especially you can position them on the table in supine decompression, prone decompression, things like that. The other way is they partner with foundation training instructors locally, and they create just a nice network. And 2, 3 instructors can really refer a lot of people to the doc, and the doc can refer a lot of people to them. And all of a sudden there's 3 people that are succeeding with this kind of common perspective. And that's how I see it help the most. And that's where I've seen the longest term relationships is the doctors believe in it. Many of them will get certified themselves, more to understand it and for their own well-being. And then they'll bring in the practitioner and the teacher. And often the doctor will take the classes that the teacher's teaching. That's where we almost have considered leaning towards that a little bit, like helping to facilitate those relationships, because it seems to work very well. It lets both operate in their specialties.
Absolutely. Yes. Thank you for that. I appreciate it. Well, I appreciate you sharing with the students. There's many more questions I could probably ask you. I guess the last question, or one of the last, maybe one more comes to me while you're saying this, is like, if you were a guidance counselor and you were trying to give advice to your daughter, let's say, who's in high school now, and she's trying to find meaning and purpose in life and wants to help people, how would you kind of instruct them to find their path to, any reflection, any advice that you would just give to a high school or college student who knows that they want to go into maybe healthcare, but they're not really sure which direction they should head or how they should go about gaining experience or anything like that?
First, meet people in the profession that you think you want to be in to the best of your ability. With the ability to watch things on YouTube now and Google things, Google everything you can about the profession and see what it's like. What's it like to be a doctor of so-and-so? Literally, Google that. What's it like to, and you'll find 100 videos on it. Watch the videos, see if you relate to it. If you are looking for inspiration for real, read books and go find lectures and everything from TED Talks to David Attenborough and the way he describes nature to Richard Feynman and the way he describes physics. And if you can get your hands even close to grabbing and grasping a little bit of what these people can help you understand, chiropractic school or medical school or physical therapy school or whatever route you go, if you go to chiropractic school and you focus on horses, it's going to make it all make more sense for why you do it and how you do it. So don't let your educational pathway be anything other than a small piece of your education in life. Plain and simple. You can go as deep as you want into the field and practice of chiropractic, but don't get lost in it. Don't make it so that everything else is a competitor to you because you're so dogmatic about what you do. No matter the schooling, no matter what. Learn a bunch of cool shit and practice it. Don't learn it and then get rid of it. Practice it. Keep it fresh. Make your life involve more than just this little thing that you learned. Because what everybody that goes through chiropractic school notices is it's a really long time as you're going through it. And then it's this tiny blip on your radar of life. Tiny. So small. So if that's the only thing you know, you only really learned during a blip. So you got to know a lot before and you got to know a lot more after. And let chiropractic education or whatever education set the tone. But, you know, that's really all it should be.
And then lastly, I got to just ask you, so this project, Pre-Chiropractic, I've structured Pre-Chiropractic into a program that's 6 stages. You know, you just explore the what, the why, the how, on a basic fundamental level. Then you learn the skill sets. The skill set, I created a framework called the inner state, which is like your inner scientist, thinker, artist, teacher, entrepreneur. And then your apprentice experience is the 3rd stage, where you go out to offices, gain experience and reflect on it. And then your 4th stage is you start your own pre-chiro club on your campus or get involved with an existing one and like really get an experience of what it's like to start something for yourself and just what that feels like to represent something. And then the 5th step is your independent study capstone. And the 6th step is the admissions, which is usually where people start, is at the admissions. So just trying to kind of create a better framework. I'm just curious what your thoughts are on extending the runway for maybe they don't even go to chiropractic school, maybe they go to physical therapy school or they do something else, but just establishing a pre-chiropractic track within kinesiology departments or different colleges around the country, around the world.
It makes sense if long as there's enough people going through it that are interested, which I think there are. You know, there seems to be a significant interest in natural medicine and in chiropractic. College is interesting these excuse me. College is pretty interesting these days. It's kind of a chaotic place to go and people are having trouble with it. But if you know what you want to do and there's a way that you could be on a better educational track than just basic pre-med for chiropractic, I think that's a good idea. However, I think there's also a huge value in being pre-medical and being exposed to the different allied health sciences before you go to chiropractic school. Something that chiropractic does a very bad job of is representing itself well in public sometimes. It really does. It's so, this is the way it has to be in our profession. And this is what makes us different than you, that some people are like, oh, I'm sorry, I didn't mean to offend you. It's like almost like too fragile. Chiropractic is a beautiful educational system that also includes, you know, chiropractic manipulation of the spine. The education is about the body. The education is about the nervous system and the digestive system and how all of these things intersect and connect and this and that. And our approach to treatment has something to do with hands-on care. But the messaging, the languaging of we're different, we're separate, I disagree wholeheartedly. Not with creating a track that helps people understand chiropractic better and maybe be better doctors, but it's not pre-chiropractic. It's let's look at the pre-medical track. Right now, they're just really learning science and barely. What if we made the pre-medical track inclusive of chiropractic, inclusive of physical therapy, inclusive of osteopathic and dentistry and optometry. And we taught students before they went to any of these respective schools that healthcare is integrated. Symptoms express themselves regardless of what you learn of how they express themselves. Regardless of your approach, symptoms exist, illness exists, cancers exist, heart disease and these things exist, no matter what you think you know. So let's all pull what we are going to learn by first learning to work together and to understand that we're meant to work together. And if we could do that and make pre-medicine inclusive of all of the allied health professions, we would probably have a better outcome on the other side. That's my approach to it.
I'm with you 100%. I just am not sure if they're going to be inclusive of chiropractic in the way that we would hope that they would be, just based on looking at the health landscape, the healthcare landscape, and chiropractic not really being fully implemented into the healthcare hospitals. Or, I mean, there's really no representation of chiropractors in health centers on college campuses like there are nurses and medical doctors and potentially other types of allied health providers. But I hear you, and this is just a conversation. At the end of the day, I'm asking new questions. I think by asking new questions and exploring those questions, we get new places.
So my experience is unique in that I've gotten to see I've gotten to go and interact with very high level different medical professions, and including like Olympic level kind of competitive sports where you're integrating with a lot of different teams and this. And my personal experience and what I've witnessed and what I've spoken with many athletes, coaches, and chiropractors about is how inclusive it is. We love how inclusive it is. That pretty much every professional team has chiropractic representation. Pretty much every college team has chiropractic representation. Pretty much every high school team has chiropractic representation. That's the truth. Pretty much every hospital system has chiropractic clinics on either side of it, very nearby, seeing the same patients, although it's not part of the system. Most of the schools, clinics will allow chiropractic students. Now, this is my experience. I don't know if I can speak for other schools, but in my experience, you can usually get like chiropractic internships that will let you go into an osteopathic school, into an allopathic school, and see what they do and join their rounds for. I mean, sometimes feeling excluded is because you pull yourself away. And my personal experience with the chiropractic profession is that through maybe some insecurity, which I've experienced myself as well, we pull ourselves away and sometimes put our middle finger up. Here's my only question. If we were the ones making the rules, would we be as inclusive as we would like of them and their principles and their perspectives? Or would we want to be right and believe we were right? So you have to ask that. I've learned a lot of lessons being kind of on the business side of this and not being a chiropractor and having to really learn how to like introduce our work to a lot of different professions. And I used to really frown at diplomacy, but sometimes diplomacy is a great idea, like in healthcare, and in teamwork. And in things like that, where you want to be on the same page as people and not just disregard them. So you just got to sometimes look at yourself and be like, okay, are we being as inclusive as we want them to be of us? And I hope any student asks themselves that along the way. That's all.
Well, thank you so much for sharing with the students today. This was a very insightful conversation. I really do appreciate it. I will obviously be posting stuff to Foundation Training if people want to connect with you. And thanks for taking the time today, Eric.
My pleasure. My pleasure. Thank you for the invitation and for taking the time with me as well.